name is Rachel Conklin, and I'm a physician assistant in the Gastroenterology Center at Valley View. I'm here to talk to you today about colon health. What we perceive as a good, healthy colon is a colon that is functioning in the manner in which it's supposed to, or which we'd like. That means that your colon is working to help you produce a soft, formed, brown bowel movement of stool on a regular basis without great effort through a process called defecation. Symptoms or concerns that may indicate that your colon is less than healthy would be changes in your bowel patterns. This could be a change in how frequently you're having to go to the bathroom, a change in the way that you are eliminating the stool from your body. It could also include diarrhea, constipation, abdominal pain, gas, and bloating, in addition to other signs that aren't specific to the GI tract, such as unintentional weight loss, fatigue, or a new diagnosis of anemia. Alarm symptoms, things that we look for that warrant a more soon evaluation, would include things such as blood in your stool, in addition to those signs of weight loss, unexplained fatigue, or anemia, and also a nocturnal pattern to your bowel movements. Colon cancer is actually the second leading cause of cancer death in combined men and women following lung cancer. And actually, in males under the age of 50, it is the leading cause of cancer-related death. About 1 in 23 men and 1 in 25 women will be diagnosed with colon cancer over their lifetime. When colon cancer is diagnosed early, the survival rate outcomes are great. There's about a 90% 5-year survival rate if diagnosed when the disease is localized to the colon. There are 6 key prevention strategies to preventing colorectal cancer. The first includes screening. We're so fortunate that colonoscopy screening is possible, as colonoscopy screening is actually preventative. When we do a colonoscopy, not only are we able to detect colon cancer before symptoms may be present, but we can also remove polyps that are present within the colon that would 10 to 15 years left unremoved turn into cancer. The second way to prevent colon cancer is by living a healthy lifestyle through having a healthy diet. Recommendations specifically would include having a diet that is high in fruits, vegetables, whole grains, dietary calcium, and minimizing red meat and processed meats such as hot dogs and deli meat. The third technique is to have daily exercise. Exercise has been proven to decrease your colon cancer risk. In addition, the fourth thing would be to have a healthy BMI. People who are obese or overweight have an increased risk for colorectal cancer, as well as poorer outcomes with treatment. The fifth thing would be to minimize or preferably eliminate any alcohol intake. Alcohol is a risk factor for colorectal cancer. And the last and sixth strategy would be to stop smoking if you are currently smoking, or to stop the use of any tobacco products. You should start screening for colon cancer at the age of 45 based on the most up-to-date guidelines by the American Cancer Society. You may be at an increased risk for colon cancer, and in these circumstances, you'll need to talk with your provider about when to start screening and what type of screening you should undergo. You may be at an increased risk for colon cancer if you have a family history of colon cancer, if you have a personal history of polyps of the colon, if you have a history of inflammatory bowel disease, including Crohn's or ulcerative colitis, or if you've had a history of abdominal radiation or pelvic radiation. Additionally, if you have a hereditary cancer syndrome in your family, it would be important to talk with your cancer specialist about when you should start colon cancer screening. If you've had persistent abdominal pain, bloating, loss of appetite, constipation, diarrhea, or another type of change in your bowel patterns or the appearance of your stool, or if you've had unintentional weight loss, a diagnosis of anemia, or have been feeling overall ill, you may need to see a gastrointestinal specialist. We're very fortunate to have GI doctors and providers here in the Valley View Gastroenterology Center that would be happy to discuss these concerns with you.